extending the continuum of care is more than just a clever catchphrase, although it is that. I like the idea that care can be extended beyond a treatment phase, for example. Addiction is a chronic disease, and it is associated with changes in the brain that take time to heal. The length of time in which we engage in recovery promotion efforts, the continuum of care, if you will be individualized according to the data that we've gathered on that individual's progress in recovery.
In general, the most vulnerable times in recovery support are 12 to 18 months. We know that more relapses occur during that time, but the vulnerability can extend to up to 5 years plus. And of course, individually, people have to take a look at that. We do have some evidence that extending the continuum of care for 4 or 5 years can be very successful. Collegiate recovery programs that offer recovery support to college-age students across the nation are very successful in helping people extend that recovery for long periods of time. Really, recovery support is indefinite because addiction is a chronic illness, a chronic disease. And so some forms of recovery support may have to be in place for the rest of somebody's life.
Providers benefit from recovery support because recovery support enhances the effectiveness of treatment. So it allows them to extend their efforts to provide effective treatment over the continuum of care, a longer period of time.
Payers benefit with those successfully navigating their recovery by allowing them to stay in recovery long term. Oftentimes there's a pattern where people get out of treatment and then they struggle in their recovery and have to go back to treatment, sometimes several times. And so by providing recovery support and extending that period of time that people are in recovery, it saves tremendous amounts of resources, and it also saves lives.